Thanks so much for joining us again today.
Great to be here. Thanks for having me again.
I cannot wait to get into this discussion. I have to say that increasing issues with ketamine, as well as the increasing use of ketamine for great reasons, have both been so prevalent recently. But as ketamine grows in what we know it can do, the good things for it, it is absolutely crucial that we discuss the kind of shadow side, the dark side of what can happen when that use is not responsible. So, as somebody who's really well versed in this, I'm very appreciative that you've come on to talk about this. So, you've been in the ketamine world for a while. Can you tell me when I don't know if I want to say when you first started seeing things become a little problematic, or maybe you can even just start with the fact that let's address the issue that ketamine, while the one legal psychedelic that most of us have access to, happens to also be the one that has this addiction potential and sometimes an overdose potential as well. Can you discuss a little bit about that?
Sure. It's interesting. I've had involvement with psychedelics for a few decades. However, my involvement with ketamine has been in more recent years. I My exposure to ketamine previously was me witnessing its use as a drug of abuse and a recreationally used substance. And I didn't know it could be used as a psychedelic either. So my first awareness of ketamine wasn't as this beautiful psychedelic from the heart space. It was more of a recreational drug of abuse. Once I was introduced to it medically, my eyes were wide open about the potential of this medication when used properly. But that was also really balanced by my eyes being wide open to the potential to this medication being a drug of abuse. When you look at, go ahead.
No, I was just going to remark on what an interesting perspective that is to see you kind of had the dark side exposure first, and then you got to see the good side, but that really primes you to be extra vigilant for that dark side when it pops up.
Absolutely. Ketamine really can act as different drugs depending upon the dose, right? So I think that recreational users like this lower dose that more appeal, it hits on your dopamine, your opioid receptors. So it makes you really feel euphoric. It makes you feel stimulated and it makes you feel somewhat intoxicated at those lower doses. That changes when you get to a higher dose. When you start involving NMDA receptor antagonism, that's when your heart space can open up and really healing can take place. But it's interesting that dosing is referred to negatively in the recreational space. So people that utilize ketamine recreationally usually really try to avoid the therapeutic dosing range of it, which is very interesting.
Yeah, I've seen that in articles that they'll write about the dissociative effects as a side effect or one of the possible negative effects. And for me, coming from the therapeutic space, I'm like, isn't that the only effect for that's isn't that the primary effect? So it's very interesting that you point that out. That you're right. It's got to definitely depending on what you're looking for in an experience is how you would see that dissociative level. And so you mentioned that it does affect the dopamine receptors, and as far as I understand, that's what often leads to something having a chemically addictive potential, correct?
Along with your mu opioid receptors. So similar to what heroin or OxyContin binds to, right? So yeah, definitely your feel good, your pleasurable, your numbing, your euphoric receptors at low doses. And no, and it's interesting, those high doses, that dissociative experience, that isn't something that people are drawn to the abusability of.
Yeah, that makes sense because I recall like I've only had it in dissociative, I've had one IM and one IV session, and I've never thought like, oh, I want to go back and do that a ton of times. Like that is an experience, and a very isolated experience, and it, can kind of take a lot out of you and gives a lot to you, but never something that I've by any means craved. And so I've never taken it at these more, I guess, recreational dose levels. And so it's interesting. What kind of behavior or like use pattern in those, it's hard to say recreational versus not these days, like if you're getting benefit from it, depending, I don't want to label it recreational, but let's just say for ease of use, we're talking about, more low dose users. But I guess here's another thing to think about. A lot of people with COVID, they're being given a lower dose for like maybe a lozenge or a nasal spray, and we're doing the telemedicine. So can you talk a little bit about how now those lower doses are being used psychotherapeutically as well?
Absolutely. So that's what my company specializes in is low dose teletherapy, right? So the focus being on psychotherapy and then using small amounts of ketamine to accelerate that psychotherapy. Now, we're being very careful with how many of those we dispense and how we dispense it. And I think that there's a difference of giving someone a course of 6 treatments or 12 treatments that's circumscribed and you're not going to create a dependence out of versus regular, if you're using this medication for someone regularly with psychotherapy in the long term, like anything else, you're going to create a dependence. So I think that we have to be responsible in our prescribing practices. We can mess up ketamine just like we've messed up every other addictive medicine that we prescribed, right? The opiate crisis, largely physician mediated. If we think about, benzodiazepine dependence, again, largely physician mediated. I can keep going down the list if we want to include SSRIs or stimulants, right? So this is about physicians being mindful and conscious and thinking beyond having repeat visits from our patients and what's in our patient's best interest. So for this is really, this gets kind of dark, Lynn Marie, when we think about physicians and how we prescribe. And when we create dependencies in our patients, we're also creating financial security for ourselves. And I think this is something that isn't discussed very much in medicine. And so what's nice about prescribing ketamine responsibly is knowing that this is hopefully going to be short term. And we can take that conflict that might arise out of the situation. I'm opening up a whole nother can of worms here. I'm sorry, but it's something that I don't think gets discussed much among doctors.
Well, I'm okay with you opening that can of worms because I mean the okay, side tangent, which I almost never do, but there's so many people that come to me and think that doctors, your average doctor, like primary care doctor like myself, gets paid more if we write antidepressant prescriptions. And I'm like, absolutely not. That is not a thing that happens. But you are making a good point that if you are say a ketamine assisted psychotherapist, then you can get paid for 6 visits or you can get paid for visits in perpetuity. Well, one of those is going to get you paid more. And so it's absolutely important that we point out the responsible use of ketamine by physicians. So that's, because frankly, going into this talk, I thought we were going to be discussing mostly like the responsible ketamine use by patients, because very often we're talking about, people who just have access to it one way or another, whether or not it's physician mediated. But thank you for bringing that extra point to it.
Well, how often do we hear about patients who started off their addiction through their doctors?
Exactly.
So
Yes.
so there are people that get addicted on the streets first, but there are also people that get turned on by us and then figure, oh, wait a minute, there's a cheaper way to get this. And
Absolutely.
so the physician responsibility and for patients, and that's again it's a responsibility to educate people that this is not something to be taken every day. There are risks. There are consequences to your bladder, to your blood pressure, to your kidneys with regular use, but also to your mind. There's a chronic dulling effect that can occur from the chronic excitotoxicity. If you're, I mean, so part of why ketamine works is because it lights up your brain in all these different ways. And when done occasionally, intentionally, it moves you. But if you're always doing that, it ends up having a reverse effect, causing damage.
That makes a lot of sense. And I'd love for you to, because, I think you started to touch on why this has become kind of a popular Silicon Valley thing. It's the same reason that microdosing back in the day did. And we're going to talk about that in a bit too. But, oh, if this helps me get slightly more creative or like you say, kind of lit up mentally, that's the allure to doing it, especially when it's something that, also may heart open and the other things. But can you talk a little bit about when that, like you said, it when that
How much
dulling
is too
effect,
much?
yeah, when the dulling effect happens, when the bladder symptoms come into, when we start having those addictive properties show up, can you talk a little bit about that?
Yeah, I mean, so your question is kind of like how often is too often? And I think that this is a very hard decision for people to make on their own. It's like to give someone goes out and buys a big bag of ketamine and then is supposed to leave it up to themselves how often they should take it. And unfortunately, because of the addictive qualities, you start getting into a place where the drug is making decisions instead of you. So instead of the rational person having a medically, a balanced, informed decision of when you should be using this, you have the addiction forcing you to use it more than you should, which gets to the place of, I hate to say, really to utilize this under medical supervision.
I,
It's a tough one. How do we, so if people are using recreationally, I think you're asking what is a recommendation to people who are out there using recreationally?
and I don't
Is-
mean for that to, I
That's a
realize
tough
that is definitely how it came out, but I think we are making the same point, which is that seemingly all kind of unregulated use has significantly more potential to go awry than this medically monitored use that you're suggesting.
Yeah, it's also dosing wise. It's amazing to me when when I give ketamine, it's with such reticence and such exacting in the doses, right, by milligram, and then I hear about people doing a line of a powder that they don't know what's in. And it's scary now with fentanyl being adulterating a lot of powders that are out there on the street, and quality. Ah, it really scares me when I think of people I know that are doing this. So if you are going to get it prescribed to you, you know that what you're getting is pure and safe, because we can talk about the risks of chronic abuse and overuse, but what about the fact that this is a heavy duty medication that if you cross the line can cause you to stop breathing and then die. Like it, so
Yeah.
there is an actual real danger to ketamine. And then when I hear about in recreational circles the popularity of the combination of cocaine and ketamine, with no knowledge to the possible cardiotoxicity, it can give you a lot more likely to give you a heart attack if you do those together. And people are chasing that. Um, so there is a lot of potential for misuse and danger to ketamine, and there's a balance to everything. And whereas ketamine is saving a lot of people's lives right now, it's also probably causing some damage to others.
Yeah.
And we really need to be careful with how we're dispensing this and the message that we're giving people about this medication,
Yeah, absolutely. And that's why I wanted.
so that we use it as a medication.
Yes, exactly. And I wanted, because I don't think, there's been so much about it being it is so good for so many things, right? A wonder drug for suicidality and depression and many things. But I don't think as much is discussed about the potential side effects. So, like you had just alluded to a few of them, can you talk in a little bit of detail about some of the dangers? Like you said, there's bladder issues, there's cardiotoxicity. If you could talk a little bit specifically about some of the things, because maybe that will help people make more mindful choices when they have a, like you said, we have to educate. What are, if they think there's no side effects, no downfall, of course.
Depression.
Depression.
Depression with a capital D, right? So people are going to take this and self-medicate for depression. They're going to over-medicate and they're going to cause a mood disorder. So if not depression, maybe an agitated bipolar type picture, or maybe an anxious depression, or even a psychotic reaction, right? So like, I think the organ that is most prone to damage from overuse of ketamine is the same organ that we're touting it fixing, the
Interesting.
mind.
Yeah. That's a very good point. And that absolutely that the same medicine you're the same condition you may be taking it for, you could be doing more harm than good without responsible use. That's a great point. Can you talk a little bit about? I don't think people know about the bladder irritation that much, and does that
Why is no? I also wonder why no one is self-medicating with psychotherapy. It's a lot safer.
is it
There's no bladder toxicity with psychotherapy.
do
Um,
they have to talk to themselves though if it's self-medication? Who are they talking to? That may be the difficulty
I
there.
hope I hope they're good listeners to that.
True, true.
Um,
Yeah, so there's some bladder
so
issues.
yeah, so ketamine gradually eats away at the lining of the bladder, and then can gradually eating through damaging the bladder can have a backwards effect on the kidneys. So it can actually bladder damage to kidney failure to blood pressure issues to recently saw an interview with a patient who needed a kidney transplant because of his long-term high dose ketamine abuse, and he was in his early 30s,
Wow.
right? and and then so also people ketamine is commonly mixed with alcohol, so you have to worry about hepatic liver toxicity, so you can get chronic liver damage from ketamine as well, and we don't talk about that. Ketamine can cause high blood pressure, and if you're utilizing ketamine every day, along with maybe smoking cigarettes or drinking along with it too, you're going to increase your chance of heart damage. And so really when we start talking about the organ systems that can be affected negatively with ketamine, we have the brain, the genitourinary, the hepatic, we can, and the cardiac, right? So some major parts of the body can break down when you overuse ketamine.
Wow. Yes. Thank you for pointing out like that entire chain of events that can happen. We've probably all seen in the media some there have been some deaths and they, people consider ketamine kind of related. Can you talk a little bit about generally what the mechanism, have there been suicides because of that depression that comes with it or related directly to the ketamine's effects?
So I'm glad you bring up death. That was the last side effect I was going to list. And I think it's primarily through accidental overdoses, right? Like, and that's why a lot of physicians still use a cardiac monitor when they're giving patients ketamine. This medicate, we use it in doses of 1 to 2 milligram per kilogram. Anesthesiologists use it in doses over 2 milligram per kilogram to intubate people. So again, when people are putting something up their nose in unknown concentration, the chance that they might accidentally have too much, stop breathing, have heart failure, and die is quite likely, especially if your ketamine is mixed with fentanyl. But even if it's not adulterated, ketamine is serious and dangerous. And it's life saving also, right? So you're going to hear both of those from me. I am the biggest protagonist of it, but also very much aware that it is really dangerous and can be dark.
And I am so thrilled that we're having this discussion because we're on this cusp where we're finding out all these amazing things ketamine can treat. It can save so many lives. But like everybody saw back in the 60s and 70s, a few bad things happen. Psychedelics get put away for years. And so I think even if, looking at the bigger communal picture here is if if you're an individual and you're looking at your own ketamine use, there's what damage could I be doing to myself? And then what damage could I do to the potential, hundreds, thousands, millions of people that could benefit from this, but that benefit may be truncated with irresponsible use, drawing negative attention to it.
So I really try and inform my patients of that and inform them that they're part of this movement. So, so that when I hand them this medication and we talk about the risks and the warnings, and I let them know that, bad outcomes are going to come around and can possibly have bad effects on the whole movement. So we need to take individual responsibilities as well for the greater good.
Yes. Oh, I love that. I love that your medicine comes with that like little extra response. It is a responsibility. People are given the great benefit of this fantastic medicine, but it does come with that extra, please help other people who could benefit from this by using it responsibly.
And so those of us that are really heavily involved in this industry and growing it and designing it right now need to be aware that what we set up now can have serious ramifications on the future of humanity if we don't set up the proper safeguards now.
Yes. Yes, yes, yes. Hallelujah, Dr. B. Thank you for bringing that up. And in that same vein, I know you wanted to touch a little bit about the abuse of microdosing, which is another thing that is so popular in this movement, but I think the same trope would apply there.
So I think when we think about these medications, we should think about combining them with therapy and not just taking these medications as medications. We don't want to repeat the failures of the last 40 years of psychiatry with taking more drugs without therapy and having negative effects. So that's why with ketamine, I'm really recommending it with therapy, not just ketamine, but ketamine with therapy. And so microdosing, and psilocybin, LSD, ibogaine, DMT, fantastic molecules, but to be taken with intention and with psychotherapy, right? To integrate the use of these medications for the long-term benefit of us instead of a short-term fix. So I get nervous when I see microdosing getting picked up by the masses as just another daily pill. And and then I see psilocybin as just another drug that starts with the letter P.
Yeah, absolutely.
Um,
I
you know,
yeah.
and maybe what? If everybody that took Prozac or Paxil did psychotherapy, those drugs would probably work better too. So and that's where it's like part of this movement is let's get back to psychotherapy and away from the quick biologic fix.
Yeah, I agree. And I think that's what part of the magic of many of these psychedelics is that they facilitate psychotherapy. I don't know how well, you take a Prozac, you go into psychotherapy, doesn't necessarily facilitate it right then and there. Not at all, not in the same way that these medicines do, right? And so I think hopefully that message will come across as like maybe you hated psychotherapy before because it was really hard for you to open up. That's the game changer here. These will
It's
help
a
you.
whole new psychotherapy, and this is a psych and these medicines actually feel good. I had a patient a couple of weeks ago who came out of his journey and he said, "Oh my goodness, I didn't know that it was okay for medicine to feel good."
Oh,
Right?
yeah.
It's okay to feel good, and that's a paradigm shift too.
Yeah, absolutely. If the medicine can make them feel good and then the therapeutic alliance they're making with the therapist can feel good, then the therapy itself is able to be much more effective. This, like you said, it's an entire new paradigm. So if psychotherapy has failed somebody out there listening before, this is not the same psychotherapy.
It's different. Try it. It's try it again, please. This is something, it's something different. And these medications can give you a whole new perspective and excitement to go into psychotherapy with.
I love that. If
I've been a psychotherapist. I've been a psychotherapist for a really long time. And combining these medications with psychotherapy has me a lot more excited, and I've witnessed changes in people that I haven't in decades.
Oh, I love that. I love that. I think that's something that has hopefully is a big takeaway from this episode that I had not seen before. Yes, we I love that we took it from the dark side, but we've come out with the bright side, which is psychotherapy. First off, I'm a fan of it for everybody because if you're gonna have a personal trainer for your body, might as well have a personal trainer for your mind. Why, like I think everybody can benefit in some way. There's zero people out there that have not suffered some trauma at some point. You could have had like the most glorious childhood. Somebody somewhere has, wronged you in some way that maybe even is just below the surface. So psychotherapy, great, but especially in conjunction with these medicines. And if you've done psychotherapy before, please don't rule this out as the same thing you've undergone. There's a whole new world out there.
And one other thing I have to mention is let's talk about all the people out there who have taken psychedelic medicine. They've had experiences and they don't know what to do with these experiences. They haven't fully integrated. They've done them recreationally, or they've taken a journey down to Peru, and now they're in their living rooms in Akron and they don't know what to do. Find a psychedelic psychotherapist who will work with you and do integration work with you and help you. Just because you've utilized those medications before doesn't mean you can't do psychotherapy about them now. So I just as we were talking, I that light bulb went off of let's encourage people who've done the medicines but not the work. Go do the work. It's not too late. Talk about your visions now.
I think that's a great point because we were just saying, like, if you've done psychotherapy before, this is not the same. If you've done psychedelics before, psychedelic assisted psychotherapy is not the same. These two things together are going to be completely different from probably what you've experienced, either one just by themselves.
Absolutely.
Fantastic. I always love having you on because you are like the most passionate guest. Like I wish everybody could see you while we were doing this, but like I just love your passion for this, for healing and for these substances and their safe use. And so please let everybody know where they can find you and more about you and your clinic.
Sure. I'm Dr. Mark Braunstein. My company is called Reconscious Medical. You can find us on the web at reconsciousmedical.com, and we're helping people with psychotherapy with ketamine and cannabis.
Amazing. Thank you, Dr. Braunstein. I really appreciate you coming on and sharing all of your wisdom with us.
Thank you so much. Have a great afternoon.
Absolutely. For everybody else out there, until next time.